E-prescribing, the case for RcOPIA, meaningful use. An efficient e-prescribing solution for physicians. Presented by Jomo Kunika, Shanae Searcy, Karen Lopez-Patrick, and Alethea Emanuel. The goal of this presentation is to make a case for the use of e-prescribing using an electronic health information technology solution called RcOPIA Meaningful Use, widely known as RcOPIA MU. RcOPIA MU is a top-notch software solution for electronic health records and electronic medical record systems. Some important abbreviations to note during this presentation include EHR, which stands for Electronic Health Record, EMR, which stands for Electronic Medical Record, and MU, standing for Meaningful Use. In order to make our case for RcOPIA MU, it would be helpful to have an understanding of e-prescribing. E-prescribing is short for electronic prescribing. It is a healthcare information technology system involved in the electronic transmission of prescription information from the prescriber's computer to a pharmacy computer. E-prescribing replaces paper prescriptions that patients would otherwise carry or fax to the pharmacy. The electronic process of prescriptions reduces errors that could commonly occur with the old-fashioned paper scripts. This figure is a diagram of an electronic prescribing process. As you can see, this process shows a built-in system of alerts and advisories to assist in reducing medical errors, thus promoting patient safety. E-prescriptions are transmitted through the Pharmacy Health Information Exchange, which allows providers and pharmacists to share information safely and securely. E-prescribing systems. There are over 100 companies that offer products to implement an e-prescribing system. Basic e-prescribing systems allow clinicians to look up the medication and send the prescription electronically to participating pharmacies. However, more sophisticated and complex systems like RcOPIA MU, these systems can interact with electronic health record systems and automatically generate the prescription based on patient history. This interaction, however, requires computer-to-computer connection between the pharmacist and the provider's office. Each prescribing software company has different procedures for acquiring their system. According to the Department of Health and Human Services, all companies will require the provider's DEA, NPI, and their license number. And then from this point, the user can decide whether they will have a team from the company come to the site for more formal training or complete online tutorials provided by the company. When acquiring an e-prescribing system, costs vary depending on the capability and the design of the software. This table of sample costs includes results of a survey conducted by the Texas Medical Association. The Department of Health and Human Services points out that this survey did not include costs for training and expansion. Implementing an e-prescribing system. The U.S. Department of Health and Human Services suggests other aspects to consider when implementing an e-prescribing system in your organization. These aspects include networking costs such as internet connectivity, wireless network, and integrating the practice management system into the new system. Also, one should consider software licensing fees, future upgrades, hardware, training, and additional support, annual costs of subscription and licensing fees, establishing communication protocols between the practice management system with the e-prescribing system, and also certification of transactions. There is hardware involved in e-prescribing. Different devices from desktop computers to handheld phones and iPads can be used to deliver the service. The picture of the iPad shows a screenshot of our RcOPIA dashboard. Depending on the needs and budget of the facility, the capability and design can vary. So in getting back to our case for RcOPIA MU, you may ask, what role does it play with e-prescribing? Well, RcOPIA MU is one of the pioneer software solutions. It provides real-time access to patient data and improved communication and collaboration at the point of care. It's actually the healthcare industry's #1 e-prescribing solution, as it includes e-prescribing, medication reconciliation, and medication history functionality, and is available as a standalone service, or it can be integrated within your electronic health record system. This system was developed by Dr. First Incorporated, which is a leading healthcare IT and informatics company located in Rockville, Maryland. When discussing health information technology solutions, it's important to note governmental factors that will affect the solution. For RcOPIA MU, governmental factors support this healthcare information technology solution and is actually a major influence of its existence. According to the Center for Medicare and Medicaid Services, adopting the standards to facilitate e-prescribing is one of the key action items in the government's plan to expedite the adoption of electronic medical records and build a national electronic health information infrastructure in the United States. Also, the Medicare Modernization Act of 2003 has given momentum to the electronic prescribing movement. It's created a new voluntary prescription drug benefit under the Medicare Part D plan. Also, under the Medicare and Medicare EHR incentive programs, electronic prescribing via certified EHR technology is a requirement for eligible providers in order to achieve meaningful use. Healthcare information technology leaders regard e-prescribing with RcOPIA as a great health information technology solution. The software solution assists in keeping patients safer, improving outcomes, and streamlining workflows. The solution is always current, with industry requirements bringing new offerings to market faster while avoiding costs and disruptions to the practice's operations. It is regarded as an easy-to-use system that empowers medical and dental practices as well as hospitals. RcOPIA MU follows one important principle of operation that centers on a horizontal view of the healthcare information technology spectrum. It identifies systematic challenges that detract from the efficiency, accuracy, and safety, whereby improving clinical outcomes, strengthening healthcare technology interoperability, and ensuring patient and provider security. There are several benefits of this health information technology solution. RcOPIA MU helps clinicians and medical practices to work more efficiently. It's easy to use in terms of interface and layout. It provides the same benefits as any meaningful use program, yet with less time commitment, finances, or staffing. RcOPIA MU provides easy access to medication history, efficient adherence monitoring. There's also a smaller software investment resulting in a greater return on investment from federal programs. It provides easy data migration to over 60% of electronic health record and electronic medical record systems on the market. And of course, it has the ability to e-prescribe. Physicians, nurses, clinical managers, and pharmacists are amongst those who use RcOPIA MU. Let's see what they have to say about this new technology.
Since beginning prescribing, we're safer. I think we're more efficient, we're faster, we're more nimble. I think we're also more financially sound.
It used to take us 15 minutes to do a prescription, and now it only takes us 2 minutes, and we have greater reliability with the prescriptions.
It's much more efficient. There's less backtracking and double work that gets done with faxing, calling pharmacies, faxing again, making sure they received a fax, getting confirmation from a fax, and then making sure that they can distinguish handwriting. It's very beneficial for out-of-state patients because we have a lot of elderly patients who may go and spend 4 or 5 months down south somewhere, staying warm down in Florida, and we have the opportunity that if they forgot a prescription at home or they've lost a prescription, that we can refill that for them to the closest pharmacy near them.
It's very beneficial, and we're grateful for it. Just one click, and it goes right to the pharmacist. No phone calls, no paperless. So we're happy.
My time is probably the most valuable thing that I have right now in my life. So by saving that 20 minutes or a half hour or having to drop the prescription off and then come back and pick it up if they say it's not going to be ready while I'm waiting, it just saves me that whole inconvenience of having to wait for it. So it gives me more time to do the things that I think are more important.
I once saw a picture that said pen and paper can be hazardous to your health, and I think that's true. Without these kinds of safety nets, it's just inevitable that something's going to happen and errors are going to fall through. Not through anybody's wrongdoing, just people are human, and any kind of added support is a plus.
So when your doctor uses RcOPIA, there is less wait time at the pharmacy, less worry about losing a written prescription, and less worry about your pharmacist being able to read your doctor's handwriting. You also don't have to remember all the medications taken and dosages because RcOPIA keeps that information for you and your provider. Is RcOPIA worth it? Well, if you add safe prescribing methods, minus transcription errors, minus prescription fill times, the results will give you patient safety and patient satisfaction. And happy patients share their experience, and this is great for business. We conclude that RcOPIA MU is worth it. It is a healthcare solution that is definitely improving the delivery of healthcare. For more information on e-prescribing and RcOPIA, please follow the links on this reference slide.